Gather and clean required examination equipment. You will need a tendon hammer, neurotips, sharps bin, cotton wool, and a 128 Hz tuning fork. Perform hand hygiene. Introduce yourself to the patient and check their identity by confirming their name and date of birth. Explain the examination and seek verbal consent to proceed. Consider if a chaperone is required. The patient should be positioned sitting comfortably on a chair or examination couch. Make sure the area to be examined is adequately exposed, whilst also taking care to maintain privacy and dignity. Assess the patient for any distress and ensure they are well enough for you to proceed. Ask if they have any pain, clarifying the location. The examination follows an inspect, tone, power, coordination, sensation, reflexes structure. Both sides should be compared as you progress through the examination. Inspect for tremor, skin lesions, neurofibromas, scars, muscle wasting, fasciculations, abnormal pronation, asymmetry, and deformity. Ask the patient to put their arms out straight with palms facing downwards and look for an essential tremor. Next, ask the patient to keep their arms outstretched, turn their hands over, and close their eyes. Look for a pronator pyramidal drift, a parietal drift, or pseudoathetosis. To prepare for checking tone, ask to hold the patient's arm, support its weight, and ensure the muscles are relaxed. Check tone by flexing and extending the arm at the elbow slowly and quickly. Supinate the wrist slowly and quickly. Spasticity is velocity dependent and rigidity is present throughout the whole movement. Examine power against resistance or pressure for the following movements: shoulder abduction and adduction.
Keep them there, don't let me push down, as best you can. And push down hard as you can.
Elbow flexion and extension.
Keep them bent, don't let me straighten them. Keep them bent, don't let me straighten them. And push me away. And push me away here.
Wrist extension and flexion.
Up like this. Keep it there, don't let me push it down. Keep it there, don't let me push it down. Bend your wrists like this. Keep them bent, don't let me straighten them. Keep them bent, don't let me straighten them.
Finger extension and flexion.
Straighten your fingers. Keep them straight, don't let me bend. Keep them straight, don't let me bend. Bend your fingers like this. Keep them there, don't let me straighten them. Keep them there, don't let me straighten them.
Thumb abduction.
The muscles here. If you point your thumb straight up towards the ceiling, keep it there, don't let me push it down.
Opposition.
Form a ring with your thumb and little finger. Keep it there, don't let me pull through. And we do the same with the left hand. Point your thumb straight up towards the ceiling, don't let me push it down. Form a ring with your thumb and little finger. Don't let me pull through.
Finger abduction.
This muscle here. Push your index finger out this way. Don't let me push it in. I will examine this muscle here. Push your little finger out. Don't let me push it in.
You should be careful to isolate the muscle group to ensure you are only testing the intended group.
Push your index finger in. Don't let me push it in. And the little finger out. Don't let me push it in.
Grade power from 0 to 5 for each movement. Perform finger-nose testing.
Touch my finger and touch your nose. Touch my finger, touch your nose, touch my finger, touch your nose. And we'll do the same with your left hand. Touch my finger, touch your nose, touch my finger, your nose, my finger, your nose.
Test for pain sensation, light touch, and temperature. In general, one tests from abnormal to normal. For patients with a peripheral neuropathy, test from the periphery and move proximally. For those with a dermatomal or specific nerve affliction sensory loss, test from the abnormal to normal and map out the area of sensory involvement. Pain is tested using neurotips with the patient's eyes open.
Do you feel that? Sharp like a pin? Turn your hand over. Tell me when it gets sharp.
Yes. 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 Yes.
Show me the other hand.
Yes. 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 Yes.
Is this sharp?
Yes.
Same as that?
Yes. 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 Yes.
The neurotip should be disposed of immediately in a sharp spin. Light touch is tested using cotton wool with the patient's eyes closed.
Light touch. So close your eyes. Tell me when the cotton wool touches you.
Yes. 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 Yes.
Cotton wool is disposed after use. Temperature sensation may be tested using a cold metallic instrument. Next, test for vibration sense and proprioception.
Do you feel it buzzing?
Yeah.
Stopped?
Vibration sensation is tested by placing a vibrating 1.28 Hz tuning fork on bony prominences, starting distally and moving proximally.
And if that was not felt, I'd go to here. Tell me when it stops.
No. 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 Yeah. Stop.
Do the same with the other hand.
Yeah.
Tell me when it stops.
Stop.
Tell me when it stops.
Yes.
Tell me when it stops.
Yep. Yep. Yep.
Proprioception is tested while the patient closes their eyes by moving the distal interphalangeal joint of the index finger and asking the patient to describe if their finger is moving up or down.
Where's it moved?
Down. Down. Up.
Show me the other hand. Now this is up, this is down. Close your eyes. Where's it moved?
Down. Down. Up.
Okay, thank you.
One may move to the wrist or elbow if necessary.
Up. Down.
If that was abnormal, I'd go to the elbow.
Down. Up. Down.
And if that was abnormal, I'd go up to the shoulder.
Up. Up. Down.
Test the biceps, supinator, and triceps reflexes. The patient's arm should be relaxed and supported. In general, an angle of 110 degrees at the elbow is best. For the biceps reflex, the tendon hammer strikes the index finger or thumb. For the supinator reflex, the tendon hammer strikes the middle finger. For the triceps, the tendon hammer strikes the tendon directly.
This is the last.
Use reinforcement if necessary.
So hold this tuning fork. When I say now, I want you to grab it tightly. Now.
Grade the reflexes elicited. Clean the examination equipment and perform hand hygiene. Thank the patient, then allow them to dress. Explain your findings to the patient and complete appropriate documentation in the clinical record.